Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thanks so much for joining. Today is Tuesday, November 9th, and it's your opportunity to get your COVID questions answered. Lots and lots of nice messages in from people really excited to have their 5 and 11-year-olds starting to get vaccinated. We saw thousands of Chicagoans between 5 and 11 get their first dose of the Pfizer COVID vaccine just in the last few days, and that's been really good to see. I also have a number of friends, doctor friends, et cetera, whose children were in the trials for these vaccines, and it's been nice for them to be able to find out if their child had gotten the placebo or the real vaccine, and think a little bit about the science of how we know these vaccines work, how we know they work, how we know they're safe and effective. So please go ahead and send any questions you have about that. Another big piece of news was the early data from the second pill to help prevent hospitalization and death for people who are infected with COVID. So we can talk a little bit more about that too. But as always, you can put your questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. And let's take a look at the data. CHI.gov/COVID- lets you know how we're doing from a COVID perspective in Chicago specifically. And where we look, we are definitely continuing to see cases on the rise. We're now averaging 382 cases per day. That's up 21% over the prior week. And a few of you have been writing in wanting to know, how does testing play into case numbers? And certainly we look at those together. Craig Curtis on Twitter, for example, is wondering about how the case counts compared with the tests performed. So where I look at a 21% increase in cases, and I say, is that real or is that related to testing? I look at the change in testing over that same time period. Tests are also up, averaging 22,310 as a daily average, but that's up 5% from a week ago. So if cases were up 5% and tests were up 5%, we'd say there's no major change there. It's just, it's just the amount that you're detecting more. But in this case, unfortunately, with a 21% increase and only a 5% increase in testing, this is a true increase. We also are seeing, with that increase in cases, an increase in positivity. That's another way it's not a testing artifact. So we're now at a 2% positivity, up from 1.7% a week ago. Hospitalizations and deaths are both down. Not surprising. These are always the ones that lag a little bit. So vaccinations are up, which is good to see, averaging almost 9,500 a day over the last week. That's both a combination of young children starting to get vaccinated, people getting booster shots, and lots of people getting their first and second doses. So I want to pull up just a little more data, and I encourage you, as always, to explore on that dashboard if you want to see what's happening by age, race, ethnicity, zip code, etc. So update to the travel advisory. Arkansas was able to come off the travel advisory today. So we're still seeing some of these states in yellow managing to hold down COVID numbers. And a lot of those are in the South, the places that got hit really, really hard with COVID earlier, and the places that frankly are indoors more during the height of summer with air conditioning. So we'll see where things move here, but not a lot of movement related to the travel advisory. People who are fully vaccinated continue to travel. The travel advisory is for people who are not fully vaccinated. In terms of our community transmission and risk matrix chart, at 382 cases, we remain in that substantial transmission range, getting closer back up to high transmission. The positivity and our hospital capacity are all in the lower risk or lower transmission range, which is good, although we are seeing some increases there. And still very, very, very strongly, I've been saying this for almost a year at this point, but the highest risk always for getting diagnosed with COVID, spreading COVID, et cetera, is being unvaccinated. And it's interesting to me how many people still think that the vaccine doesn't protect against COVID or doesn't protect against COVID spread. It absolutely does, and that's what these graphs are showing. The red line is going back to March, Chicagoans who are diagnosed with COVID and are unvaccinated, versus the blue, Chicagoans diagnosed with COVID who are fully vaccinated. Similarly, where we look at some of the children, especially the over 12s who have already had the opportunity to get vaccinated, in the dotted line here, we see COVID cases among vaccinated 12 to 14-year-olds in the light blue and 15 to 17-year-olds in the dark blue, compared to, so much higher, 10 times higher in those unvaccinated kids in that age group. So right here in Chicago, just during the Delta surge, where 15 to 17-year-olds were not vaccinated, they were 7 times as likely to be diagnosed with COVID. And for 12 to 14-year-olds, they were 10 times as likely to be diagnosed with COVID during the Delta surge. We will continue to see this same pattern. Because cases are on the increase in Chicago at the community level, I do absolutely anticipate more cases in all settings that have children. More cases in schools, more cases in daycares, more cases in sports gatherings. And having, for children who are old enough to get vaccinated, it is by far the most important thing you can do to protect yourself from getting COVID and protect yourself from inadvertently spreading it. Where we look at hospitalization and deaths, it's even stronger. Again, in red are unvaccinated Chicagoans versus blue, fully vaccinated Chicagoans who have been hospitalized with COVID, and then death rates the same. Just in the Delta surge alone, unvaccinated Chicagoans 7 times as likely as vaccinated Chicagoans to die from COVID. We are at 75.9% of Chicago's residents having had Chicago's residents over the age of 12 having had a first dose of vaccine. We've got about 35,000 more people to go in that 12 plus group to reach our Protect Chicago 77 goals. So we're making progress. Both North Park and Avondale, you see on the map there, reach 77% of 12 and up Chicagoans getting their first dose. You can see in blue are the community areas that have hit at least 77%. And in terms of communities where at least 77% have completed their vaccine series, you can see there's many fewer communities there. Citywide, we're at 70%. The darkest blue, again, represents those where more than 77% are fully vaccinated. In terms of some other community area milestones this week, both Washington Park and West Pullman hit the point where the majority of Chicagoans 12 plus are vaccinated, over 50%. Oakland, South Deering, and West Englewood hit that 60% benchmark. Albany Park and Lincoln Square hit the 80% benchmark. Good to see every community making progress, but we still have some that have more to go. This next few days and weekend, there's a number of important deadlines in terms of being fully vaccinated in time for the upcoming holiday season. November 11th, this Thursday, 2 days from now, is the deadline technically to get your second dose of Moderna and Pfizer or your first dose of J&J to be fully vaccinated 2 weeks post your last vaccine in time for Thanksgiving. We're strongly encouraging children in that 5 to 11-year-old group to try to get that first dose as soon as possible. If you can get it, in the November 11th, or obviously we're pushing a lot November 12th, being approximately 2 weeks before Thanksgiving. Would love to see a lot of children already have started to get some of that protection, and of course making sure adults who will be gathering for Thanksgiving and older teenagers have had the opportunity. But if you look just over these next few days, November 14th marks that deadline for the beginning of Hanukkah, and then we're also getting into the beginning of the time for getting vaccinated for Christmas and Kwanzaa. So November 13th marks your date for your first dose of Moderna if you want to be fully vaccinated with Moderna in time for Christmas. November 14th, you got to get that first dose of Moderna in time for Kwanzaa, and you can see the other dates from there. So really important, especially with COVID on the rise here in Chicago, heading into the holidays, knowing that these are likely times for surges and outbreaks because of travel, because of gathering, to make sure that you're as protected as possible. All right, so let's go ahead and get into some of your questions. All right. Diane Ponder from Facebook says, I'm just back from NYC. Any advice? So Diane, if you're fully vaccinated, there's nothing particular that you need to do. If you were out and about and seeing a lot of people or in touch with folks who are not vaccinated, you want to be extra careful. I would recommend doing a test, 5 to 7 days later. But as long as you're fully vaccinated, just wear that mask, which you have to do indoors anyway right now. But other than that, keep an extra eye out for symptoms, wear the mask, take a test if you have any particular concerns. If you're not vaccinated, you would need to follow the guidance for quarantine and testing. Ramiro Medrano on Facebook is asking, where can you get a Pfizer booster? So Ramiro, there are about 700 places around the city where you can get a Pfizer booster. Maybe it's more like 600, but hundreds and hundreds. If you go to chai.gov/COVIDvax, you can see lots and lots of places that have Pfizer boosters available. Pharmacies have Pfizer boosters available even without appointments. Community events, your own doctor. You can call our at-home program, 312-746-4835. We can set up boosters at home, or we can help you figure out where there are opportunities for boosters near your house. And that's true even if you'd asked about Moderna boosters or J&J boosters. There's lots of availability of boosters of all three kinds of vaccine, and I'd love people to get that booster. Really, this week is the right time to get it if you want to be as protected as you can be ahead of Thanksgiving. So good question. And if you've got more specific questions about your situation, give us a call or put them in the chat. Angela Monty on Facebook. I am 58. How long do I need to wait for a booster shot? All right, good question, Angela. And we're getting a lot of these kinds of questions. I want to be really clear about this. In terms of how long you have to wait to get a booster shot, if you got Pfizer or Moderna, first of all, no matter what age you are, you have to be 6 months after the second dose. So if it's been 6 months since your second dose of either Pfizer or Moderna, you're eligible from a time perspective. If your first dose was Johnson & Johnson, just 2 months later, you're eligible for a booster dose, regardless of age. So that's in terms of the time. Now, in terms of your age, first of all, we strongly, strongly recommend that anybody over the age of 65 get a booster. We strongly recommend that anybody over the age of 50 with an underlying condition of any kind get a booster. So Angela, for you, if you have any kind of underlying condition, I would encourage, if it's been 6 months or 2 months since J&J, that you go ahead and get a booster. We also, in addition to strongly recommending those over 50 with an underlying condition and anybody over 65, we also strongly recommend that anybody who got J&J get a booster. And for people who got the J&J, if it's no difference to you one way or the other, I would get a Pfizer or Moderna as your booster. Otherwise, you can stick with your same vaccine. For people, though, who do not have underlying conditions or who are younger than that, boosters are available and recommended for anybody over the age of 18 with any underlying condition or who is working or living or being in a potentially higher risk setting. So I, for example, have encouraged my employees to get a booster if they're 6 months post their Pfizer or Moderna vaccine, for example, because they're coming into work every single day. They're interacting with the public. They're in settings potentially at risk for COVID. And so I have strongly encouraged people to get vaccine. The older you are, the more I encourage it. At 58, maybe you're lucky enough to have absolutely no underlying conditions, but if you are wanting to get a booster shot and you're concerned about gathering risk factors, et cetera, you can get it. You do not need to have a doctor's note. You're not going to get turned away for getting a booster if you're over the age of 18. We're especially pushing for people over 50 with underlying conditions and people over 65, but I am encouraging people. We have plenty of availability here of boosters. You're not taking vaccine away from international opportunities, for example. People who have not gotten a first or second dose always are going to get priority, but right now we're fine in terms of vaccine availability. Andrea Daytona from Facebook. What's the purpose if you've already been vaccinated to get a booster shot? Yeah, good question, Andrea. So the most important thing, as you point out, is getting those first doses of vaccine. And that is the most important thing you can do in terms of protecting yourself against COVID. There was a nice study, a big study out from CDC just in the last week or two that looked at people who were admitted to the hospital after either being vaccinated and getting COVID, so breakthrough COVID, but potentially, getting sick enough to be in the hospital, and people who had previously had a COVID infection but had not been vaccinated, got COVID again, and got admitted to the hospital. The people who had not been vaccinated but had been infected in the past were more than 5 times as likely, actually, to be infected. So we've been talking all along. The best protection is people who have both had COVID and been vaccinated. The next best protection is people who have been fully vaccinated but not had COVID. The next is people who had COVID and have recovered but are not vaccinated, and there are significant drops-offs for each of those. And then the lowest level of protection, of course, is people who have neither recovered from COVID nor been vaccinated. And we still have about 750,000 people in Chicago in that lowest category. So the booster is really about recognizing that where we are seeing breakthrough infections, meaning people who have had, who are fully vaccinated and yet getting diagnosed with COVID, after about 6 months, particularly with the Moderna and the Pfizer, especially in people who are older and have underlying conditions, that's where we start to see some of that immunity waning. To be clear, 99% of the people still here in Chicago who have been fully vaccinated have not had a breakthrough COVID infection. 99.9% have not been hospitalized, 99.99% have not died. But where we are seeing those breakthroughs, it tends to be in people with underlying conditions and those who are older. And so what it does is it really gives your immunity a boost while we are still very much, unfortunately, in a relatively, high status time for COVID. It helps give you an even higher level of protection. So kind of boost it back up to that 90% plus mark. So, my biggest concern is if you haven't gotten it at all, but if you have, that's where I am encouraging people generally to get the booster if you're able. Okay. Mary Cruz Torres from Facebook. If I take my kids to get vaccinated soon, can I get the booster there at the moment? Yeah, thanks for that question. In the great majority of the places, we are trying to very much do that because I would love to have parents and guardians and aunts and uncles and grandmas and grandpas and everybody get their boosters, get their kids some. This Friday, for example, as part of Protect Your Health on the 12th, we're doing a big push. City of Chicago employees, for example, are getting 2 hours paid time off if they want to get their first or second dose of vaccine in advance of the requirement by the end of the year, if they want to get a booster shot because it's about 2 weeks prior to Thanksgiving, or if they want to take their kids to get vaccinated, or any combination. So I can tell you, for example, every Saturday and Sunday, looking ahead, if you go to chi.gov/COVIDVax, you can see all of these calendars, all of these opportunities. CDPH is standing up in partnership with city colleges, these larger events every Saturday and Sunday, except for the weekend of Thanksgiving. First doses, then 3 weeks later, second doses if needed. You can get boosters, you can get child vaccines, you can get first or second doses, and most providers are offering that. Pharmacies are offering that, and I would even take it a step further. Many are also doing flu vaccine at the same time. I got my flu vaccine and my COVID, my Pfizer COVID booster on the same day, one in each arm, and there are kids definitely who have been getting even the 5 to 11-year-olds who've been, if they haven't already gotten the flu vaccine, there are some that are getting the first COVID vaccine with your flu vaccine. I've also given people their booster and their flu, so combinations are good and we recommend it. All right. Okay, so a couple of people writing in, again, sort of about kids and low risk. So I see Kenneth on Twitter saying, if kids are low risk and the vaccine does not prevent infection or transmission, what's the point? I also see Derek Wolfcastle on Twitter saying, numbers continue to decline. Children are being unnecessarily injected. The fear factor to sway the 2021 elections has failed. Why are we perpetuating this scam-demic? So, let me address both of those. First of all, Dredrick, if you have been lucky enough to not be touched by COVID, if nobody among your friends or family have been among the millions of people diagnosed with COVID, and the hundreds of thousands who have died, good luck to you. But this is not a scam-demic. I worry a little bit where you're thinking about this is related to elections, et cetera, I could not care less about sort of the political piece of this. Numbers are not declining. I don't know, here in Chicago, they are on the increase. And related to children, and to get to Kenneth's point, kids being low risk, thank goodness children all along have been at lower risk of the severe outcomes from COVID. Like, we were afraid at the beginning this was going to look more like influenza or so many of our other respiratory viruses, where young children and older people, there's sort of a U-shaped curve where we see the very youngest and the very oldest get hit hardest. Thank goodness children, by and large, have been less likely to get seriously ill. But anybody who's telling you that there are no kids who get seriously ill from this, they're actually not telling you the truth there. Most children might have a little bit of a nasty respiratory infection and come through it just fine, but they are just as likely to be infected with COVID, and they're just as likely to spread it. But also, there have been more than 8,300 children just in that 5 to 11-year-old group that have been hospitalized with COVID, and a third of those kids did not have underlying medical conditions. So yes, 8,300 is not as many as the hundreds of thousands among the older, but it definitely can happen. The CDC also, in the conversation about approving vaccines for 5 to 11-year-olds and authorizing that, pointed out that COVID has been among the top 10 causes of death in this last year for 5 to 11-year-olds. Thank goodness 5 to 11-year-olds are not very likely to die, right? It's not the top cause of death, but it's in the top 10, and it's vaccine preventable. And so there's also this MIS-C you might have heard about, the multi-inflammatory response that comes after COVID in children. There have been 5,000-6,000 kids hospitalized with that after COVID infection, some of whom have had long-term issues. And so in terms of kids being at low risk, yes, they are definitely at lower risk for these severe outcomes. But it can happen, and it is not entirely predictable. Where a third of the hospitalized kids in this age group don't have underlying conditions, that is something that I do worry about. And in terms of this comment, the vaccine does not prevent infection or transmission, boy, do I continue to hear that. And I'm not sure completely where that's coming from. There is no vaccine that is 100% protective. No vaccine. Even our measles vaccines, they're 98 or something % protective. But in terms of helping to prevent infection and transmission, the vaccine is by far the most protective thing you can do. In this study for children, just to remind you, for those 5 to 11-year-olds, study was in about 4,500 kids in the U.S. in that 5 to 11-year-old group. 2/3 of the children got the COVID vaccine. They initially tried 3 different doses as they were sorting out doses, but in the larger trial, 2/3 got the Pfizer vaccine and 1/3 got a placebo, a saline injection. And then, just like they do for the other studies, they follow these kids forward, and 17 kids got COVID in the placebo group, and 3 kids got COVID in the vaccine group. So the vaccine was 91% protective against COVID. Is it 100%? It is not. But imagine if you had something that could cut your risk for, cancer by 90%, or something that could cut your risk for, we wear seatbelts to help cut our risk of serious injury in a car accident. The vaccine is not 100%, but boy, is it good. And I have been so pleased with how well this vaccine has done, not just at protecting people from getting COVID, but yes, also at preventing spread, because you cannot spread COVID if you are not infected with COVID. And even if somebody has a breakthrough infection, meaning they've been vaccinated and they do get it, they're much less likely to get severe symptoms. Their symptoms last much longer, and they're much less likely to spread even in that case. So thanks for that question, because I do think that it's an important, it's an important piece where we see people getting COVID after having been vaccinated. Those cases are much more mild. I don't worry about people getting hospitalized or dying in the same way unless they have active cancer or something. All right. Christina Judge from Facebook. Okay, yeah, just to this point, thank you for this. She says, I believe the vaccines work. My husband, vaxxed in April with J&J, developed only a mild case of COVID last week, despite having uncontrolled diabetes and being sick most of the time. I got a Pfizer booster a few days before he tested positive, remained symptom and COVID-free, despite quarantining with him in close quarters. Yeah, thanks for that. I hear stories like this all the time, where people have gotten a breakthrough case. I say, thank goodness they had that vaccine. You know, there are some people in my family who developed a breakthrough case of infection before they were able to get a booster. Moderna boosters had not been approved yet, et cetera. And, you know, they can sometimes get sick, but I'm not worried about them getting hospitalized or seriously ill. And somebody with, you know, uncontrolled diabetes like your husband, et cetera, as you know, would be really high risk. And to the point of, you know, you're in close quarters, that's the very highest risk setting you can be. You've had your booster, you're much less likely to get infected. We see that over and over again too, yeah. So thank you for that. Megan on Twitter, can you talk a little bit about the research behind the pediatric vaccine? What did the trials actually show? So in addition to what I was just talking about, where the trials showed about a 90%, 91% protection against COVID in the trials, they also showed at this lower dose, right? This was a third of the dose for Pfizer. They showed no issues, no serious side effects, not a single case of myocarditis or pericarditis in that trial in the 5 to 11-year-olds. They actually expanded the trial, you know, watching for that. The most common side effects were actually no side effects, but after no side effects, the next most common was soreness at the injection site, followed by fatigue or mild headache. After the second dose, we saw some children, but a low percentage having some of the, you know, fever, not feeling well like we saw in adults. But we did not see any problems with longer term or other side effects. Let me tell you, every child I know, age 5 to 11, in my personal life, has either already gotten that first dose of vaccine or is signed up to get it in the next week or two. My Facebook page, of course, is, you know, many of my friends are doctors and are in the healthcare profession. Some of them actually had kids in the trials. So I mentioned this, right? Like these trials always are done on volunteers, and often, you know, it's the doctors who want to sign their kids up because they're the most excited about potentially having protection for the kids. And so some of my friends who had kids in the trials, for those 5 to 11-year-olds, they've now what's called unblinded the trials. So they're finding out, you know, I have one friend who since May found out that one of her 5 to 11-year-old kids had gotten the real vaccine and one had gotten the saline. And so he is now getting the real vaccine. The trials for the younger kids going down to 6 months are still going on. The safety's looking good there. They're working on dosing. But these vaccines, especially, I think this dosing is good. This lower dose makes the side effects less likely, makes the protection level still just as good. And I'm really excited about it. Those of you who are putting in the nice comments, I appreciate that. It's nice to see some positive shout outs. Deb Beasley, Andrea Daytona, Angela Murray, thank you. Okay, we've got a question. Are any of the COVID-19 pills authorized for use yet? And are the Merck and Pfizer pills the same? What do they actually do? Good. Let's talk about this for a second because we haven't actually talked so much about some of the newer therapeutics that are coming down the pike. So one of the biggest breakthroughs, not yet authorized by the FDA, so not yet available, but something that I expect to probably be coming available in the next month or so, probably in November or December. The FDA is looking at data from 2 different pills for people who are infected with COVID and at high risk for being hospitalized or dying, that are helping cut the risk of getting hospitalized or dying. And so the first one, and so these have not yet been authorized, but the data in the trials, and just as a reminder, These follow the same kinds of trials that the vaccine studies do. First, there's studies in preclinical, not even in humans. Then there's the first round where you're looking at safety and dosing, and then the second round in small groups. And then you go to these phase 3 trials where you're testing these and you're giving some people who, the only people in these trials are people who have COVID. Also, in the first versions of these trials, the only people being enrolled were people who had COVID, were not vaccinated, and who had some kind of risk factor for severe illness. They were over 60 or they had an underlying condition. And the idea of these is they work kind of like a Tamiflu or some of the other medications that we use for influenza. Vaccine is our first line of defense against influenza. But if we see breakthrough infections or we see people who didn't get vaccinated getting flu, if you go and see your doctor very soon after being diagnosed with flu, just in the first few days, there are pills you can take that really cut your risk of getting seriously ill. And it's been something we've been hoping to get developed for COVID. So in both of these studies, because right now, just as a reminder, the only thing that's available like that are the antibody treatments. So if there are people who are at high risk for severe illness, whether or not they're vaccinated, if they are diagnosed with COVID, you can get an antibody infusion, but it's quite expensive. I mean, it's not expensive to the patient, but it's a expensive, sort of difficult procedure because it's got to be given through the IV. You've got to make appointments. But for people who are at high risk, that's really what's been available. The thought of having a pill that your doctor can prescribe, that you can get at the pharmacy, that you can take at home, and you would probably take it for about 5 days, is very exciting. So in the trials, in the same way that the trials for the IV antibody cut the risk of hospitalization by about 70%, that Merck trial cut the risk of hospitalization or death by about 50%, which is really good. And then this most recent trial from Pfizer, that pill actually cut the risk of hospitalization by about 80% or 83%. So the potential to really be important here, if there are people who do get either breakthrough COVID or were not vaccinated and develop it. The good news is this study was done pretty recently, during the time Delta was out there, and the pills work slightly differently. They're both adaptations of technology that's been under study for about 20 years, so they're not new technology, but they've been adapted for COVID, and they work slightly differently. So the Pfizer one, for example, really stops the replication, stops the virus from continuing to be able to replicate, and therefore is less likely to make people seriously ill. So the potential for real breakthrough there, we'll be watching very closely. Europe, I think just today, gave the first nod to the first pill, I think the Merck version. And so this is going to be one of the real probably advancements that I would expect. The FDA is looking at all the data right now in the next month or two. All right, Ashley Hines Elwood on Facebook. What about if your child has had COVID recently? When the adult vaccine came out, they said to wait. I haven't heard the same info regarding children. Are we to wait? Yeah, really good question. So one of the main reasons when the adult vaccine came out, we asked people to wait that 3 months is because the chances that you're going to get reinfected with COVID after being vaccinated after recovering from COVID in that first 3 months are very low. And we didn't have enough vaccine available. If you remember at the beginning, we were really trying to prioritize vaccine where it was most needed. For the kids, we have enough vaccine available. And so there's not a recommendation from the CDC or from CDPH to wait any particular period of time. If your child has had COVID, you got to wait at least the 10 days for them to no longer be infectious and to be fully recovered. You want to make sure they're recovered, lets their immune system, sort of get that lesson. And then personally, I would move ahead with vaccine at that point. If you did want to wait, I would do it 3 months later, but honestly, I would just go ahead and get the vaccine, particularly as we're heading into the winter with the safety and efficacy data for kids being so good. So really good question. Okay, not sure how we're doing on time. I think we're getting close there. I'll take, so the News Knockout on Twitter says, are you seeing more cases in schools because you're doing more testing in schools because there's policies that reward weekly testing? Could that be a factor? So no, we've actually been correcting for this. And all along, what we see in schools, and if you look, we've got this posted online, in Chicago public schools, for example, but also in that age group, no matter where people are in schools, what we see is that even with the significant increase in testing, we were seeing decreases in case diagnosis because cases are going down in the community. As cases go up in the community, cases will go up in school. This is the lesson we have seen over and over again, because schools have good mitigation in place. They've got the distancing, they've got the masking, they've got the protocols. You've heard me say for probably a year and a half now that settings that are trying to be careful about COVID are generally not the places where we see widespread problems. You can have occasional clusters and outbreaks, but generally it's a very good question, because you always want to think about how does testing weigh in. I will say we are seeing more cases diagnosed in kids than previously because there's some more testing in schools. But in terms of that change from sort of the beginning of the school year forward, et cetera, that all has to do with cases in the community sort of showing up in schools. So I hope that helps clarify it. Diane Ponder from Facebook. I have art openings this weekend. Of course, I'll wear a mask. I have a little cough. Should I get a booster before the show? I'm 65. Yes, you should get a booster. You're 65, and getting a booster is, as long as it's been 6 months since your second Moderna or Pfizer dose, or 2 months since your J&J, I would definitely get a booster before the show. I think it helps. The cough, though, not related to the booster. The booster won't make you sicker. So I'm not sure if the cough is you're worried it could be COVID, in which case you should also take a COVID test. But otherwise, I would recommend getting a booster, especially if you know you're going to be sort of out with some folks and you're in that age group where we definitely recommend it. So good question. I would suggest it. Lee Mabry White on Facebook is asking, will there be a second vaccination day to follow November 12th to make sure everyone gets fully vaccinated? So we're going to actually be doing a press conference today at 1 o'clock with some more detail from CPS, but also from a lot of the other city partners, libraries and parks and others about the Protect Your Health on the 12th. There is not going to be another day off school on the 12th, but we've done a lot of work. For example, you don't need to do the dose exactly the 3 weeks later. There's lots of availability in that weekend. There's going to be availability at schools. Our goal really for Friday is to make sure that kids and their families have gotten started on vaccination. And there's certainly planning that's happening around that. But if you've got more specific questions about that, I urge you to tune in at 1 o'clock. Christine Esposito from Facebook. How long do you think it'll be before the booster is approved for folks under 65? The booster is approved right now for people under 65. So if you are under 65 and over 18, and it's been 6 months since you got a Pfizer or Moderna vaccine, or 2 months since you got a J&J vaccine, you can get a booster. If you've got an underlying condition, or you are going to you're working at an art show, you're in a high-risk setting, you're otherwise concerned about COVID exposure, you can get a booster. If you're over 50 with an underlying condition or over 65, we strongly want you to get a booster. For others, anybody with any kind of underlying condition or in a higher risk setting, we really recommend you get a booster. So you don't need a doctor's note, you don't need a sign-off. You can go to a pharmacy, you can go to your doctor's office, you can go to any of our walk-in clinics, the push that we're doing, even with a lot of the schools and other kid events. Boosters are very much part of that, and you should not be getting turned away for getting a booster. So let us know if you are. There's plenty of availability. It's just this difference between strongly recommend versus recommend. If you're 18 years old and healthy, and not working in a high-risk job, I don't think there's a lot of indication for a booster. But as age goes up there, or if you're particularly worried about it and you're over 18, I would say go for it. Okay. All right, I think we'll end just on this last question here, a comment from Terry Dodd on Facebook. Terry says, thanks for everything you do. Thank you. Appreciate it. Says, I had COVID twice before the pandemic, and it wasn't nice. I thought I was going to die. I'm fully vaccinated now, plus I got my booster and the flu shot. I hope the vaccination numbers continue to go up and the hospital numbers come back down so we can take the mask off again, too. Terry, I am right there with you. Thank you for, I'm sorry you had COVID, especially twice before vaccines were available. I'm glad now that you've gotten that vaccine and the booster. You've done everything you can at this point, right? If you've recovered from COVID, you've gotten both of those, your initial doses and booster and the flu shot. You've been wearing the mask. All I want to do is get past this and take the mask off again too, let me tell you. And so I think it's a good note to end on. We'll just finish, I think, with that. And you know what? I'm just seeing one more here I want to hit real quick. Crystal Crosby on Facebook. We see an increase in death with elders. Is that from taking the vaccine? Why are so many elders dying at this time? No, there are not elders dying from this vaccine. Can I just, I was going to be done, but I wanted to just emphasize this again. More than 98% of the people here in the city of Chicago who have died from COVID-19 have not been fully vaccinated. Not vaccinated. 98, 99%. How many people in Chicago have died from getting the COVID vaccine? Do you know? 0. 0 Chicagoans have died as a direct result of getting the COVID vaccine. So the increase in death that we are seeing among older people is partly because that's the group most likely to get the breakthrough infection or to have the underlying conditions, but also because we still have, believe it or not, a good number of people over 65 who are not vaccinated, and those folks, unfortunately, continue to get really ill and die from COVID. We compare, you see me here, I shared today the difference just in general between vaccinated and unvaccinated Chicagoans and risk, but you start looking at that by age group, and we still have, you look over 65, the death rates among unvaccinated people over 65 continue to be high. And when cases are going up, the risk increases for everybody, but it increases the most for people who are unvaccinated. And then it increases especially for people who are older. So I just wanted to correct that. Thank you very much, Crystal, for that question. She's also asking, has Moderna been approved by the FDA to take the second shot, or should they switch to an FDA-approved vaccine? So all 3 vaccines, all 3 of them, are authorized by the FDA to get the booster shot. So if you got Moderna for your first 2 doses, you can get Moderna for your booster. If you got Pfizer for your first 2, you can get Pfizer. If you got J&J, you can get J&J. And if you want to switch those up, you can. Personally, I recommend switching up only if you got J&J. I thought in the study the protection was a little better if you got your first dose of J&J and your second of either Moderna or Pfizer. Other than that, the protection really looked good sticking with the original. So that's generally what I've been telling people, but I just want you to know that, and maybe you're emphasizing the approved versus authorized part, I'm not sure. But if my main point is get vaccinated. So different people have different reasons that they're choosing which vaccine to get. The Pfizer is the first. It was the earliest available. It's got that full FDA approval. So if that's the one that you want to get, go ahead and get that one. The Moderna was just coming along behind it. It has a slightly higher dose of the mRNA. It's got actually the where you look at it, it's got actually the very highest protection, even a little higher than the Pfizer in the original. But with that slightly higher dose, sometimes you see a little more of the side effects, right? There's trade-offs in all of these. The J&J continues to have, for people who just remain very nervous about getting vaccinated, it's the one that's the single dose. It's got the least side effects right off the bat. And as long as people are willing to get a second dose of J&J 2 months later, that protection is also very good. So different people have different opinions about the different vaccines. I am relatively agnostic there, except to say you should get a vaccine. And my biggest worry is people who have still not made the decision to get those first and second doses. If you only got one of either Pfizer or Moderna, not good. Please get that second one. Even if it's late, even if it's been months, you got to get that second dose too. One dose of Pfizer or Moderna is not as protective as one dose of J&J. So I keep telling people still, even today, if they're really just, I want to get one shot and never have to worry about it again, J&J is your best bet. But for a higher level of protection, I would go with either the Moderna or the Pfizer, and then getting the booster of any of those helps. So. Oh my goodness, we're still getting lots of questions. I need to wrap up. I'm going to take one last one here because these are good. Jean Brooks on Facebook is saying, what do I think about about waiting until the 15th to vaccinate a child with Down syndrome? He'll be 12 on that day. I know individuals with Down syndrome have impaired immunity. I advise them to wait until the 15th. Yeah, so this has been a little bit of a debate. Technically, the CDC says you get the dose for whichever day you're getting vaccinated. It's not based on weight, it's based on age. Given that we're literally a number of days from the 15th and you're going to be careful until that point, I think, in talking to the doctor, I think it's reasonable, certainly, if you want to just wait and do that for the 15th. Otherwise, could get that for the lower dose, and then we get the second dose higher after the 15th. So it's just, right now when it's so close, it's very, it's tricky because, there are kids. I know some kids who got vaccinated. Were diagnosed with COVID literally the day that COVID vaccine was authorized for 11 to 15-year-olds, and it's just hard, right, to have made it this far and to now be seeing those kids still be getting it. So. There's not a formal piece of guidance on that. Every family is going to weigh its own situation. Obviously, a child with Down syndrome, really important they get vaccinated, and that's really the most important thing. And I think if you're going to be extra careful and wait a couple of extra days, that would probably be a logical choice for sure. Okay, so thank you. If we did not get to your question, we will come back and try to get some more of them on Thursday. Someone's here is asking, why are physicians and nurses not getting the vaccine? Something like 97-98% of physicians have gotten the vaccine, just to be clear about that. But we will come back and get some more detail on some of this on Thursday. Thanks. Good questions today. Really appreciate everybody who's tuning in. I love hearing any questions that you have. There's no such thing as a dumb question or a question you feel like you should know, because if you have it, lots and lots of other people probably have it. Or if there's just something that you're hearing a lot, for me, the two things I'm hearing a lot is people think there are no vaccines in schools, which there are clearly lots of vaccines available at schools, and people think that the, quote, vaccine doesn't protect me anyway, and it does. It doesn't protect you 100%, but it's the most important thing to protect. And so those are kind of the two that I'm hearing a lot right now related to misinformation. If there are other things that you're hearing or you think would be good to help clarify, I love getting those kinds of questions too. So thanks again for continuing to tune in. We really, we just want to get past COVID. I know you do too. So thanks. And if you're interested, we'll be doing a press conference at 1 today, and we will be back on Thursday to take more of your questions directly. Have a good day.